Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Intrauterine insemination. In intrauterine insemination, the sperm is taken from the male, can be husband, then it is intrauterine insemination H, that is husband, and it can be a donor, then it is IUIT, D for donor. The process and centrifuge the semen can be the process and centrifugation of the stamen can be done in three techniques. One, swim up technique. Second, swim down technique. Third, density centrifugation technique. So we have three techniques: swim up technique, swim down technique, and density centrifugation technique. Through this, 0.5 ml of processed and centrifuged semen with the help of catheter is put into the uterus, bypassing an area of the cervix.
thank you and thank you for watching.